My name is Ralf Dechend. I'm a cardiologist working at the Experimental and Clinical Research Center, which is a joint venture between the Max Delbrück Center for Molecular Medicine and the Charité, University Medicine of Berlin. Together with a group of Michael Bader, we investigate a novel transgenic rat model for diabetes during pregnancy with special interests on fetal programming. Diabetes is becoming a major health problem, also in pregnancy. We know that diabetes in pregnancy is causing increased morbidity and mortality for the mother and the fetus. At the MDC, we have developed a novel rat model for type 2 diabetes by inducible knockdown the insulin receptor. With this technique, we can induce the diabetes and reverse it. And second, it is a model for type 2 diabetes caused by insulin resistance. In this study, we want to investigate the differences in glucose and insulin metabolism during normal and diabetic pregnancy. The emphasis of this study was to collect continuous glucose measurements. We used the implantable glucose telemetry so that we can directly measure blood glucose measurements without restraint so that they represent real-time measurements. We used the novel device by DSI. The mating regime is rather unique and complex. So on the right side you see that we used a TET-O female which is insulin resistant and mated it with a wild-type male. During pregnancy, this rat will become diabetic, and 50% of her offspring are also diabetic, which is group 4, but 50% of the offspring in this diabetic pregnancy are wild type, which represents group 3. For the control experiment, we mated a wild type female with a TET-O insulin resistance male. This means that the female will be non-diabetic during pregnancy, and 50% of her offspring will be wild type, which is group 1, but 50% of this normal non-diabetic pregnancy will the fetuses be diabetic, or better, insulin resistance, which represents group 2. Initially, we characterized the diabetic mother and could show that blood sugar values are elevated, that the Homer index is pathological, which increased plasma insulin and plasma C-peptide levels. The next slide shows a problem with determining blood glucose measurements by the standard method. The graph shows one pregnant rat over the course of 36 days and the individual blood measurements, and connecting the dots to reveal the data, which are incomplete. With the DSI glucose telemetry implanted in the same rat, you could show how many data points and blood glucose measurements we achieve within these 36 days. The device is implanted on day 0. On day 4, we started with the doxycycline treatment to induce the insulin receptor knockdown. When blood glucose levels achieve values higher than 300 milligrams per deciliter, we started the mating and stopped the doxycycline as soon as we realized that we saw a plaque. The next slide shows the continuous blood glucose measurements in a diabetic rat and a normal pregnant animal over 32 days, and in black and white you see the day and night rhythm and the differences, especially in the diabetic rat. To illustrate the amount of glucose measurements which are possible with this DSI measurement, we show the curve of the two rats for 3 days. The next slide shows another advantage of the DSI continuous glucose measurements, namely the performance of an intraperitoneal glucose tolerance test. In the red points you see the manual measurements, and the black bars are the continuous glucose measurements, which are much more accurate. The next slide shows the IPGTTs for the complete cohort. Again in red, the manual measure points of all animals and the median and standard deviations for the whole cohort if we use the continuous glucose measurement. The present study shows that the current blood glucose monitoring is problematic because it is performed in restrained, stressed animals, and the sample collection is limited and sporadic, requiring manual labor. And this results in assumptions which are based on incomplete data. With a new device and continuous blood glucose measurements, we are able to complete accurate blood glucose profiling from freely moving, unstressed animals. At present, we are investigating the blood glucose levels during pregnancy, and the coefficient of variability is so high, especially in the diabetic setting, that a single random measurement is unlikely to be representative for the overall mean of an animal given in the diabetic condition. In the next study, we will investigate the blood glucose in the offspring to determine the influence of a diabetic pregnancy on glucose hemostasis and rest and after metabolic stress, to evaluate the role of fetal programming for future metabolic and cardiovascular disease.